Joining NAMI in March of this year, Dan was the executive director of the American Psychiatric Association Foundation, which is the public education arm of APA. And this morning, we asked Dan to join us as we wind up our plenary sessions to have a conversation. And we decided to call this, Where Do We Go From Here? And we're going to reflect on not only what we've heard during this conference, and where we are today in this country dealing with issues surrounding mental health and our communities. So first of all, thank you, Dan, for making time to join us.
Thank you for having me. I really appreciate the opportunity.
So we're gonna, I'm gonna ask you, just a couple of questions, and we can just have a coffee talk here. You started at NAMI just as the pandemic was beginning. So how has this time been for you?
It's been a time, Doug. Well, first of all, good morning to you and to all of your participants, to Vicky Coffee and all of the board members. And thank you all for what you do and to be making this investment to make other people's lives better. It's not short-sighted on my part to understand that this is all an investment that every one of you all are making to help others. So thank you. Now, in terms of COVID and me becoming a new CEO, I started January 21st. Early in March, we were confronted with COVID, and we had to immediately turn the organization virtual. And it has had a significant impact to us being able to do that, both constructively and positively. But the constructive part of it is just one simple area of our organization. We had to create continuity of operations for our helpline. Our helpline had always been brick and mortar. It is staffed by volunteers that give of their time and their lived experience to be on the phone to speak with others. Well, we always provided them with the technology inside of our building. And all of a sudden, there's no building for them to come to. So that was one of those things that we had to figure out, how do we continue that operating? So that was one, but that was 1A. 1B. 1A was to make sure that our employees were safe. So that was the first two things we had to do. And then layer on top of that is to make sure everyone had the technology to do what we're doing now, to meet virtually and to do their work virtually. So that was also a challenge that we had to meet. Now talking about what we do inside of this is all of our programs. A lot of it is that in-person interaction, the communities of practice that happens when you're together, the facilitation, the learning, the sharing, what you hear from the other person. Now, all of a sudden, you don't have that convening. So how do we try to have a rich learning experience with peer-to-peer, with family-to-family, with some of our other programs, when now you have to do them virtually? So that was a part of the learning experience with COVID.
So has it changed the way we think about community? Because that's been one of the themes at this conference this year, is the importance of community in supporting people living with a mental illness, families, and that we're all a part of this effort. So has it changed having to pivot to virtual? Has it changed the way we think about community? What has it done? For example, if you most people probably don't know, kind of what the national convention was like this year.
Yes, it has changed it from the standpoint of just a case in point, Doug, and thank you. For our convention, we normally get between 1,600 to 2,500 in-person attendees. Because we could not do our in-person convention this year, which would have been my first, and I was really looking forward to it, we had to pivot and host it and conduct it virtually. So the positive is that we had over 27,400 folks register. We had 15,000 attend 2 days, so each day. And we had folks from 37 different countries. So those were numbers that we would not have, and participants and voices and individuals that we would not have been able to touch if it were in person. So that's the positive. And there's many positives with us launching the youth mental health crisis in partnership with PBS at the convention and some of the other things we were able to do. So there's some upside from that. And then there's refreshed learning from all of us in how do we use technology to do the very best we can given the current circumstances. We know it will not be all things to all people, and we know it's a challenge, but we know that there should be while there is the distancing, it doesn't have to be where it's not social interaction, because we can use the technology for that. We have to use the technology for that.
Just to underscore your point, in talking to people here in Texas who are involved in behavioral health all over the state, there's just been a major recognition of how virtual and how telehealth, virtual meetings have really increased the audience. They increased it for NAMI National at the conference, but it's also increased the number of people who are attending our conference this year. I think some of the things that we're getting today, for example, we just heard about Bridges to Care in St. Louis, and watching the chat box, we're hearing from a lot of communities around the U.S. about, hey, how do I do that? How do I start a program like that? So, I think you and I had a talk, and we talked about the idea that next year's NAMI National Convention, is it going to be virtual? Is it going to be in person? Or is it going to be both? What are your thoughts?
It's interesting you ask, because based off of our conversation, Doug, we're looking at, should we do a hybrid, or do we actually do it in total virtual to actually get these same numbers that we had this year? And as you mentioned about the programming and all the great work, I mean, Texas is a leader in so many different areas in terms of mental health and addressing mental illness. And I'm not saying that because I'm on this call and this meeting with you now. It's because I am working across the United States. So I know of other programs in other states. And I would say that Texas is, first of all, very collaborative, very the continuity and the cohesiveness of the voices, and really working with each other. Kudos. Now, coming full circle to the technology, we're interested to see, should we do a hybrid, or should we do it all virtual? And the reason we're looking at that is because if we're going to stream different sessions, then there is cost attached to streaming those sessions that we may not have comprehended from the standpoint, which ones do we choose? If we have over 40 sessions, which sessions do you stream? And you actually have to have a huge organization, a communications company that can do, say, 30 sessions or whatever. So we're going to figure it out, because what we want to do is, to your point about different models and best practices, there's some wonderful things that the Bridges meeting that just took place, they were talking about. I came in on a tail end because I was coming from another conference. In terms of models, what we're looking at is, what can we scale and what can be replicated? What are best practices from different places that we can scale? And that's what we're looking at from the standpoint of 2021's convention. What can we scale from this one for next year?
So, what priorities has NAMI set for itself moving forward? We all recognize we're in kind of a moment. This is a major time in our history, culturally and in every other way that you can think of. So what priorities has NAMI set for itself moving forward, and how do they speak to the issues being raised at this conference?
Oh, thank you. First of all, our board, we have a 16-person board. Our president is Dr. Shirley Holloway, and she is very engaged along with the board members in terms of where are we right now, and then what are we looking to kind of be resilient and adaptive to based off of the right now? Where do we go from here? And the here has changed, quite frankly. Yeah. The here has absolutely changed, Doug. And you and Vicki and other members of our FaithNet Advisory Council, we know we have a body of work there, and we have some things that we need to do. What is apparent to us is our strategic plan. We have a 5-year plan, NAMI National, and our 5-year plan is early intervention. People get the best care possible, and diversion from justice involvement. We know that an individual that gets an individual with mental illness, oftentimes, if they do not get that care early, then they end up in the justice system. And for us to now move them into the system they need to be in, the mental health system, it's very difficult. So we'd like to get to them and divert them from justice system involvement. Best care possible, no matter what your title, income, zip code. We'd like to see that occur. And then early intervention. We know that a young person, it can take 12 years before someone actually gets the care that they need. So for a young person, they could be 25, and some of this could have actually taken place in their life when they were 12, 13, and 14 years old. So that's our strategic plan. Given that, Doug, we don't have our heads in the sand. We know that the current reality of the George Floyd murder and the racial trauma, COVID, the economic impact. We've lost over 170,000 people now to COVID. We don't know when that's going to actually level off, if you will, if there's such a thing of leveling off loss of life. And the fear, uncertainty, and doubt. In the faith community, you know that across the faith community, no matter what your practice is, we've got a lot of people that look at our faith leaders as the first responders. They are the first responders from trust, from opening up, from, it's all about meeting people where they are. And our faith-based leaders, Doug, meet people where they are. And our faith-based leaders start out listening and asking the question. And they do very intentional listening and very deep listening. And many times before an individual will go see a professional, if you will, they will go to their faith-based leader because they trust them. And they trust their confidentiality, they trust their insight, they trust that they care.
So you raised another issue, which is, how to be culturally competent. And I would also say
Yes.
appropriate to different faith traditions. So what is NAMI doing to help to recognize cultural differences, and also to recognize that we have a wide spectrum of people in faith communities in different faith traditions?
Yeah, there was a body of work that I was involved in before I came to NAMI, where we created a guide called Mental Health Guide for Faith-Based Leaders. And in 2015, we brought together a consortium of over 50 faith-based leaders, Episcopalians, Presbyterians, Imams. We brought and we also brought community-based leaders to Washington to help construct this guide. The reason we did that is we needed all the voices. We needed to hear from the many to help all of these communities. So we're still very interested in that kind of work. Now, what NAMI is doing is working with our Faith Net Advisory Council and really wanting to listen to them to see what it is that we can do to bring out to the community to help. So we want to listen versus tell. That's the first thing. But we see the huge need, and it's significant because right now we see the faith-based communities across the country being the place where people are also going. People that have lost their jobs, they're going to the faith-based communities to get food, to get support. So we see the need to have the consortium of faith-based leaders from different religions, different faiths come together to talk and to come up with solutions.
Another point that you and I have talked about a little bit, and I'd like your thoughts, is, we started this conference sort of trying to bridge this chasm between the mental health community and the faith community. And I've seen a tremendous amount of movement on the faith community side towards becoming better educated, becoming more knowledgeable about how they can be supported. So on the mental health professional side, what is being done to help make mental health professionals appreciate the faith of people that are coming to see them, and how to talk about faith? Because we are talking, and I think, we keep talking about how this is a holistic endeavor. People are whole people, and it's body, mind, and spirit. So are there any initiatives that you're aware of that to educate mental health professionals?
Yes, well, this goes back to your previous question. We're also and cultural competency question, because part of the development of the cultural competency training is faith, and making sure that our medical professionals understand how important faith is to different communities. And so we are very intentional with our DEI, diversity, equity, and inclusion. We actually hired a national director for diversity, equity, inclusion before COVID and what is taking place in terms of the economy and the racial trauma. And the purpose of that is that we knew and saw back in 2019 and before, quite frankly, that the cultural competency opportunity with our medical community, our professionals, was there in terms of how important is faith to people of color. And if I can go back for a second, just in terms of this conversation, for communities of color, particularly in terms of trust and understanding that 3% of the practicing psychiatrists in the United States are Black. 12 to 16% of the practicing psychologists, and a study from Stanford University that was done in Oakland it was a national study, but it focused there, first of all, in Oakland, that it's something like 5 to 6% of the physicians are African-American, Black. So the net is that you have to do the cultural competency training so that the professionals who don't come from that community know how to address the root cause versus the symptom. And part of that is also helping them understand how important faith is to communities of color. So that's a part of that cultural competency training. And there's many organizations that are doing that work. And Georgetown University is one of those that's doing quite a bit of work there. NAMI is doing some work there and providing resources and trying to get very engaged in being a part of the national conversation on cultural competency and how it plays and how it threads through this quilt that we're trying to construct on mental health and addressing mental illness.
And I want to commend NAMI because I know, working with the education staff at NAMI, there's been a guide for how our volunteer leaders can talk about faith when it comes up in our classes and in our groups, because it inevitably comes up, and we need to be able to talk about, faith and recognize a person's faith. And I think NAMI is definitely helping advance that discussion. So I really appreciate the work the staff is doing. I want to throw out a couple other issues that I think kind of cut across the U.S. right now, and have you respond to what you think, where you think some opportunities are. One is, you've talked about jail diversion, but that brings us to incarceration. But one of them is housing. We get more calls on housing. There are two calls: access to care. How do I get care? And where can my loved one find housing? And in many cases, find supportive housing. What are your thoughts on how we address those issues?
It is a national problem. I know this from my work when I was at the National Association of Counties and representing all 3,069 counties in the United States and traveling to many of those counties and actually visiting the jails from Cook County to LA County to Shelby County to Coconino County and so on. And one of the things that was an opportunity then and an issue then, it still is, and that was probably now for me 10 years ago, is what we call wraparound services and systems of care. And one of the things that we were working on then that is a part of all of our body of work from the National Association of Counties to NAMI, to every one of us is the wraparound services, and the wraparound services includes critically housing. So it is something that we are, while it's not the number one thing we're doing, it is a part of what we're doing, and we want to be a part of that body of work. So we are working with a couple of national organizations on housing and have a seat at the table with these organizations where we're absolutely looking at the housing because it is a problem and a huge need. So we are addressing it, and it is inside of the justice space.
Let me throw you a softball here. Tell us about NAMI FaithNet. What is NAMI FaithNet, and how does it work within NAMI?
I think I should be asking you that, Doug.
I asked you first.
NAMI FaithNet is a wonderful program that we're looking to actually spread wide across the organization. We have an advisory council, a national advisory council from the communities across the U.S. That actually deploys a program in communities of faith. And that programming is to help faith-based leaders understand and deliver support to families and individuals living with mental illness. We actually have a curriculum, and we're looking to actually update that and to make it even more robust and more of a utility to our faith-based communities. And we have a advisory council that's very engaged and actually has helped us, NAMI, really understand the criticality and the intersection. And now we just want to leverage their time and talent and actually build on what we have as this current curriculum.
Yeah, and I think just to let people know on the call that, you know, one of the things I tell people as we go out into the community is, and we talk to faith communities, NAMI is faith friendly. And the second thing that we want to let people know is that NAMI is going to be doing a national survey later on, I think this year, of affiliates throughout the United States to ask them, you know, well, what are you doing in terms of outreach to faith communities? And we'll be gathering a lot of information because one of the things I've learned being on the NAMI FaithNet advisory group is the incredible work that's being done in communities all over the country. And we just don't know enough about it. It's not as visible as it needs to be. So I think we want to try to create an even stronger network of people within NAMI that are working in this areas.
Yeah. And that's Doug, and speaking on that, that's why we've also created at NAMI the CEO task force, which you're a member of, is because we need your voice at the table. And this task force is for us to hear from the field, because what I have assessed in my 7 months here is that there is some wonderful work being done, but and I'm finding out about it by the way, when people introduce me to other people, or when I make a call, or there's some kind of interaction, because right now we can't travel, so I'm not out in the field like was the plan. That was part of my plan, was to get in the field. So it's how do we learn about the best practices? And there's so much great information that we've created a CEO task force of 19 representatives from across the U.S. that will be meeting starting on this coming Wednesday, of which you're a part of that, to learn this. And then what I want to do, quite frankly, is this is the voice from the field, and I'm looking for us to be able to see different models that are best practices, have a model of success that can be replicated and is scalable, and then find a way to actually introduce them across the U.S., because that allows us to reach more. And thank you for mentioning the survey, the organizational health assessment survey. So it is going to be a survey. We call it OHAS, Organizational Health Assessment Survey, and it is going to be looking to collect all of the things that Doug mentioned in terms of the best practices, but it's also looking to find out what can we do better. So what is, I mean, quite frankly, what's the health of the organization? And then it's an assessment tool, and we're looking forward to getting that feedback. We're going to launch it in the fourth quarter, October, the month of October.
Well, I could probably go on all afternoon asking you questions, but I know we're just about out of time. We have 1 minute left, and I want to thank you very much for joining us today. I know you have a very busy calendar. I know this is an important area for you personally, and you've been more than gracious in terms of making yourself available to me and to the other people in NAMI. So thank you for your help, and I think we have a conversation that will be going on for some time.
Yes,
so,
and
thank you.
Thank you, Doug. And if you share my email address with anyone that I see a couple of chats in there that folks are looking to reach out. So welcome that. And thank you all for what you do sincerely. And, you know, I'll just close by this. And, you know, it's a quote that is important to me. People don't care how much you know until they know how much you care. And I'm really blessed to be working with an organization and people who really care. So thank you. And thank you for allowing me to be with you all today. I really appreciate it.
Our pleasure. And I'm going to take just a minute to close out this morning session. As we move into our afternoon sessions, we're going to take about a 20-minute break. Please stay on the conference website, and you can select a workshop track. There'll be 4 workshops: Trauma-Informed Care, La Familia, Heal the Healer, and a workshop on the Bridges to Care program that we heard about a little while ago. And the slides between our sessions are going to describe more information about resources in our community in particular, and also how to obtain the CEUs. This year's Pathways to Hope conference has been memorable in a lot of ways. We've had the most number of people who've ever attended the conference. We've kind of navigated our way through this virtual world that we're now in. And I hope that everyone has learned something useful that they can take with them. That is the most meaningful thing to me about these conferences, to hear people say, you know, that they learned something, or they found out about a resource that they didn't know before. And I want to thank, in closing, our sponsors again: NAMI San Antonio, the City of San Antonio Faith-Based Initiative, West Care Foundation, and many, many other people who have helped come together to make this conference possible. So next year, we're going to meet on August 27th and 28th. We've already reserved those dates. And just to kind of echo something Dan and I talked about a minute ago, are we going to be meeting in person? Are we going to be meeting virtually? Are we going to be doing both? Well, we don't know, and we're going to find out this year. But in the meantime, please take the conference, please fill out the conference evaluations, either through the chat box or on the conference website. And we'll look forward to seeing you in the workshops that will begin shortly. Please join us. I think every one of them are great. You'll enjoy it. I hope you've enjoyed the last day and a half. Thank you very much. And thank you again, Dan.
Thank you.